Hi, myself Dr. Priya Varshney and I'm a fertility consultant practicing at Cloud9 Hospital, Gurgaon. So today we are going to discuss how to start a fertility treatment cycle in this COVID-19 pandemic. So till now, as you all know, that fertility treatments were on hold since March 2020, and everybody is stressed up that has have a lot of queries that how will we are going to start our fertility cycles or fertility treatment which were put on hold since so long. So we have resumed our fertility services, but with taking all the utmost precautions and care. First is that how we are starting our fertility services. First and foremost, we are assessing or we are categorizing the patients that who are requiring urgent fertility care, because we have to live in this COVID-19 era till the time we get a good vaccine for its prevention. So we have to first stratify the patient that who require urgent care in this time. There are a group of patients whose treatment were on hold for the last so many months due to some or other reasons. There are a group of patients whose embryos has been frozen for so many months for due to any some or other reasons. So those who were long waiting list, we are first providing treatment to them. Also, a subset of patients like who has a decreased ovarian reserve, a poor ovarian reserve, and have a less number of eggs, and due to the increasing age or increasing time, the number ovarian reserves, as we all know, that decreases. So we are first including those patients in the fertility treatment services. Also, a group of patients are also there who require fertility preservations, like a group of cancer patients who wanted to freeze their eggs before undergoing any cancer therapy. Also, there are a group of patients who wanted to freeze their eggs due to some social causes. So we are including those patients first in our fertility treatment list. Before After screening the patients, after selecting the patients, we are triaging the patients by a questionnaires which assess their risk of COVID-19 infections in this time. So this couple has to fill a triage form before availing the fertility services. Also, we are you doing all the pre-cycle assessment over teleconsultations and digital platforms, and once the patient is ready for the cycle, then we are calling them to the clinic. We are using the software protocols which require minimum clinic visits and which require minimum interventions. And also we are not at present taking the high risk patients like those who are at risk of ovarian hyperstimulation syndrome, or those who are having any other comorbidities like diabetes, hypertension, who make them vulnerable to any infections at this time. Also, we are doing strict screening protocol, and we are asking the couple to live in an isolation period till the time the fertility cycle is undergoing. And also, the if a patient require anesthesia services, she might have to undergo COVID testing also. Plus, a couple should be counseled, or we are counseling couple just if in case if they develop any symptoms during their treatment cycle, or God forbid if they acquire any COVID-19 infection during this time, the cycle will be cancelled. So that to prepare to protect their health against any other odds. So, and also we are sanitizing our premises, our OTs, our reception desks, ultrasound rooms regularly, and we are taking all the personal protective equipments. Our staff is also screened daily or on a frequent basis, and we are taking utmost precautions so as you find a safe environment for the fertility services.